Good afternoon. Welcome to today's Lehigh Valley Business Coalition on Healthcare webinar with Geisinger Health Plan. This is Amanda Green, Director of Operations for the Coalition. Just a few pieces of housekeeping before we get started. Please note that all of our attendees are in listen-only mode. Today's webinar is being recorded, and you will be able to view the webinar on our website following today's event. Please use the chat function to look for notifications from our moderators. We'll be sharing announcements that way. Please submit your questions using the Q&A function on the toolbar, and we will take time following today's presentation to answer those questions. I'll now be handing it off to Carl Seitz, President of the Lehigh Valley Business Coalition on Healthcare. Thank you, Carl.
Thanks, Amanda. Good afternoon, everyone. Thank you for joining us today for our program, Getting Back to Business with Geisinger. As I think everyone knows, 2020 is the Coalition's 40th anniversary. To say the least, it's been a challenging year. The staff has been working remotely since March. And we had to initially reschedule our May conference to September. And then about 2 weeks ago, we decided to cancel the conference and move to what we're calling the 40th anniversary webinar series. And we have speakers scheduled through October of 2020. So I want to encourage everyone to hopefully you've seen the information that's come out, and you will register and join us for those programs. I'd like to thank and recognize our sponsors. You can see the premier sponsors on the screen. Next to the platinum sponsors, and then our gold and silver sponsors. And we can't thank the sponsors enough for working with us through this year. None of our programming is possible without their support. Certainly the annual conference and now the webinar series. So I want to thank all of the sponsors for continuing to work with us through what's been a challenging year. The next program in our webinar series will be on August 11th, and it's going to be with Alec Ross, who has a best-selling book, The Industries of the Future. So Alec's space is what work will look like in the future, and now with the pandemic, he'll be presenting and speaking with us about what things are going to look like post-pandemic as businesses move into the future. I want to thank everyone with us today, including the Coalition's employer and associate members. I also want to thank the Coalition staff for the work on today's webinar and the work they do every day to make the Coalition a success. Remember, please submit any questions you have through the chat. The presentation today will be about 50 minutes with questions to follow. And the program today is presented by the team from Geisinger. We're really pleased to have with us Dr. Jaewon Ryu, who is the President and CEO of Geisinger. Also, Kurt Roble, who's the CEO of the Geisinger Health Plan. And just want to mention that the Geisinger Health Plan has been a valued purchasing partner of the Coalition for the last year and a half. And can't say enough about the great relationship and association we've had with them. Thank Kurt and the entire Geisinger Health Plan team for the work that they've been doing with us. Also with us is Allison Hess, who's the Vice President of Health Innovation. She may be familiar to you from some of the programs she's done with us over the course of the last year and a half. So with that, I'm going to turn things over to Dr. Ryu, who will start the program for us. Thank you.
Thank you so much, Carl, and thank you, Amanda, and the rest of the staff, and thank you to the Lehigh Valley Business Coalition on Health. I thought we would give you a quick update on some of what we're seeing, actually a lot of what we're seeing with COVID, but also what we've been up to and some of the programs we've been able to put in place, how we're partnering with local businesses. And of course, a lot of what we've been doing has been on our clinical enterprise side with our clinics and hospitals and how we take care of patients. But we've also had a lot of activity working with businesses and schools and others in the community to ensure, especially as functions have come back online throughout the community, that we're doing our best to do so responsibly and still keep the virus at bay. And so we wanted to give you an update of all of those kinds of activities, and then of course turn it over to you all for any questions you may have as well. But if we can go on to the next slide. I'd say a big part of our activity, and it started probably 2.5 months ago even, was Allison and her team helping us in terms of engaging with local businesses. We know that this virus has not been easy for anybody. Certainly for healthcare systems, there's been a significant impact, but just as much so for local businesses like all of you. And I know you all have felt that impact as much as we have. But as we've strived to get things back to quote unquote some state of normalcy, and of course, until there's a vaccine, we don't think there's a true normal here. But it's been a lot of activities to make sure we're mitigating or reducing the risk of spread of the virus as functions come back online. And there's been toolkits developed, resources made available, nothing short of a small army that goes out and helps people and businesses look at their space, look at their processes, look at their capabilities, whether it's testing, screening, workflow, staggering, all of those things have been a part of our recipe, and Allison's going to talk more in detail about that. But if there's one repository where there's a lot of those resources made available to all of you, it's on our website, geisinger.org/business resources. And we would encourage you all to go peruse and take a look at what's on there, because there are a lot of ready-made toolkits and so forth. At the same time, we've been saying from the beginning that the economy can absolutely recover and we can open things up and still limit the spread of the virus. But in order to do so, we have to make sure that people are paying attention to the precautionary measures such as masking, distancing, hand hygiene, and so forth. And so a lot of our effort has actually also been on the communication and education front, and we remain really active in those spaces. Next slide. Here's something that should look pretty familiar to any of you that's been keeping an eye on the media or the news recently. Of course, across the country, there are areas that are significant hotspots, and recently that's been especially throughout the South and the Sun Belt states as the virus continues to spread. We're up above 4 million cases across the country. But what we've also emphasized to people from the beginning is that it tends to be a very local dynamic. And so while one thing may be happening in Texas and Florida or earlier on in the pandemic, New York had one set of things going on. What's happening in our communities here in Pennsylvania is what we need to focus on. So at the same time that we've been zoomed out and looking at the trends nationally, we've been very much zoomed in, paying attention to what those trends look like locally. We have also seen increasing hospitalization rates across the country. Luckily for the areas that we serve here in Pennsylvania, we have seen the number of COVID patients in our hospitals trend down for the last month and a half to 2 months or so. But at the same time, it's not zero. It's sort of hovered around 15 or so patients across our system at any given time. And the fact that it refuses to go below that, I think, is a good reminder that this virus is still out there in the community. At the same time, what does give us a little bit of concern is that over the last week or two, we've seen a slight uptick in the number of cases testing positive. So the number of patients testing positive has gone up to about 25 per day. Previously, we were seeing about 16. And so we're obviously keeping a close eye on that and making sure that those don't end up as patients inside the hospitals. But gives you a sense of all the different data points that we track, and it gives us an idea of the activity level of the virus. I think throughout all of this, masking is the thing that's been the greatest, consistent, most impactful thing that we can do. And so we continue to emphasize that. And of course, you see the three of us today wearing our masks, given that we're within 6 feet of each other here. So wanted to continue to emphasize that in all the environments that we are seeing. Next slide. I think since July 3rd, so we're coming up on almost a month that the entire state has now been in green. I think there is some activity that we're seeing on the western side of the state in the Pittsburgh market. I know that they're seeing significant upticks in case activity, but by and large, the state remains green. So that allows a lot of functions and businesses to get back into the swing of things, but at the same time, can't say enough, can't emphasize enough the importance of masking and screening and distancing in the midst of these efforts. And of course, for those of you that may have been on the state website, we included that as a reference here to get the latest and greatest information as far as what the state is up to and what they're looking at as well. Next slide. This was the trend that I referenced earlier at Geisinger, and you could see this is the number of patients that are testing positive in red. And since a peak sometime in April, we've seen that steadily come down. But over the last couple weeks, we've seen it ever so slightly uptick, and you could see that in the graphs. At this point, we've tested over 70,000 patients. About 4,500 of those have come back positive. Ends up being about 6% positive rate. And at the same time, we've hospitalized over 800 patients at this point. Been able to discharge most of them safely. But of course, we've also seen some deaths as a result, as the case has been across the country. And I think this is something that we still keep an eye on as we plan our capacity, whether it's in terms of ICU beds or testing supplies or personal protective equipment. We are very, very vigilant on keeping track of all these data points. Next slide. I think that the numbers and the data, it's one thing, but really the punchline of all of that is that the virus is out there in the community, and we're going to need to be managing through it, at least for the foreseeable future. Without getting too much into the science, I think this slide is intended to illustrate the importance of wearing those masks. And believe it or not, something as simple as a cloth face mask can block over 95% of even the tiniest droplets from being inhaled and spread. And so anytime folks are in an indoor environment, or if they're going to be within 6 feet of anybody, even in an outdoor environment, we are very aggressively recommending that those folks wear a mask. And of course, to the extent they're able to avoid large gatherings and stay distanced, that's even better. And the other key being the aggressive hand hygiene. So please make a point of informing all of your customers, your consumers, and getting the word out in the communities as well, because if we do these things, we can no doubt manage through this virus. Next slide. Little bit about immunity. There's a lot of discussion, a lot of literature out there, and I think the key point here, without delving into the different studies and the antibody testing and so forth, a few things I would call out. One is the virus is out there in the community. We have not hit anywhere near what is called herd immunity, and I put that in quotes, which means that a sufficient amount of your population has been exposed and has immunity to the virus such that the virus starts to dwindle. We're not at that point yet, which underscores the importance of the masking and the distancing and the hand hygiene efforts. At the same time, as we start easing into the fall months, where we would normally, even in the absence of COVID, start seeing flu activity pick up, we know that this year, even more important than ever before, will be to make sure everybody gets their flu shot, because even from early on in the virus activity back in March, one thing that we saw loud and clear, and every market across the country, across the world saw, is the 1-2 punch of flu and COVID is really a bad, bad combination. And so we want to make sure we minimize that by getting out there with the flu shots this year, and you're going to see us be very aggressive with that. At the same time, you all have read, as have everybody else, that vaccine development efforts continue to go at breakneck pace across the world. And so there are over 100 different vaccine development efforts, several of them in this country that are even entering what's called the phase 3 portion of their clinical trials later on this summer. I think all of this is promising that hopefully we'll have a vaccine sooner rather than later. But in the meantime, the precautions that we're talking about today end up being pretty impactful for all of us as well. Next slide. We get asked a lot of questions about the treatments. You know, what's Geisinger doing about the treatments? What are the latest and greatest treatments? We've learned a lot, as has the industry, during these last 4 months. And we update our protocols according to the latest and greatest evidence. And we're also extremely fortunate because we've had a longstanding history of a research enterprise here that has allowed us to even be a part of a few of these research studies. So whether it's sarilumab, which is one type of medication that's still being studied, or the convalescent plasma, which takes the plasma and the associated antibodies from people that have recovered from the virus, infuses them into people that actively have the virus. We've been actively involved in both of those studies and continue to evaluate others. Also, you saw in the news that remdesivir, which is an antiviral medication, that clinical trial did demonstrate impact from the medication. And of course, we've incorporated that into our protocols accordingly. And then there's some things around clotting and how the virus impacts that. So we've incorporated the evidence around anticoagulation guidelines to minimize the risk of that. And of course, there's also some case reports of how it affects children a little differently and how their immune response can be a little bit different than the adults. And having a children's hospital here in the middle of central and northeastern Pennsylvania, where we're able to have a long history, again, of pediatric specialist expertise, has allowed us to adapt our protocols and bring that expertise to bear in those scenarios as well. So let me turn it over. We can move on to the next slide, but I'm going to turn it over to Allison Hess, who runs all of our wellness programs in a normal environment, but then with COVID has taken on the extra duty of managing all of our employee health, and that has also spilled over into all of our efforts to help other employers manage their employee health as they look to come back and bring back their business functions. And there are probably a whole slew of other things that Allison does for us, but I'll pause there and hand it over to her.
Thank you, Dr. Rue. Next slide, please. So as Dr. Rue mentioned, we have been very forthcoming with information and really trying to serve as a healthcare partner for our communities, as many different entities and areas are navigating through this challenging time, whether it's our patients or the employers we work with, the schools and universities or other community partners. We're really trying to determine how we can develop resources that will effectively help them navigate through this time, mitigate the risk, and again, just be a trusted partner for them. We focused a lot in the employer space with our town halls, the toolkit that was referenced, providing support, whether that's on a consultative level or trying to help employers if they have questions, have a resource that they can reach out and ask. There's a multidisciplinary team internally that's made up of infectious control docs, peds, multiple layers of folks across the organization who are committed to trying to get those answers and work very closely with the employers, as well as our schools and universities, again, offering the same type of approach, focusing heavily on education and prevention as they're working through their plans to bring students back this fall, deciding whether or not they're going to take a virtual approach or an in-classroom approach. and what steps that they need to take in order to be able to do that successfully. So really trying to have the solutions digitally available for them, as well as additionally multiple town halls and being available there as well. And then for our GHP employer groups, we're also providing additional dedicated resources where we will have teams available to have those conversations, do that deeper dive, understand what their current challenges are, even review the layout of their company and offer some ideas and suggestions for how they can get back to work successfully, providing that customized and very local support, which I think is really important. Because in all of these scenarios, there are individualized challenges and advantages for every employer or school that's navigating through this time. And our goal is to really look at them on that individualized level to try and help them with the support, the programming, and give that very customized detail to them. So that's been our approach as well for our GHP employer groups. We've also enhanced our virtual programming, talk a little bit about, and some of the other back to work resources. And then, lastly, our GHP members, again, we're an integrated delivery system. It's been incredibly beneficial as we've navigated through this time. Having the clinical enterprise resources, whether it's for clinical guidance or just the oversight to be able to support, but there's been tremendous value in having the health plan and the clinical enterprise connected as we've navigated through these times. And I think now more than ever, we've really felt the benefit of that, especially as we're trying to align some of these resources for our health plan members and our employer groups.
I think this has been, Allison, a real lesson for us, because early on we noticed that all it takes is an outbreak in a single nursing home or single place, meatpacking plant, what have you, and all of a sudden the community has this big outbreak. And it's been a reminder that we are truly all in this together. And for us, I think it also illustrated the power of being able to swim upstream. The more we could swim upstream and get involved with the nursing homes, the first responders, the local employers, and now even more so the schools and universities, we know that that's going to help our communities as a whole prevent the spread of the virus. And that's been very much our approach. We've had over 40 different schools engaging with us at this point, a whole host of local businesses. But early on, it really started with the nursing homes and the first responders who we took on that responsibility and really helped them think through the issues. And it was all on the concept that if we can prevent it there, we can prevent it for the whole community. And that, of course, includes our care delivery enterprise. So thinking through it through that bigger lens has been a big part of the solution set here.
Absolutely. Next slide, please. So just some recommendations that we've been putting forward, and I think it's important to think about as you return to work, layering on different levels of protection. And so there's a great analogy that one of our infectious control docs uses and says, this whole approach to getting back to work is kind of like Swiss cheese. And if you have one layer of Swiss cheese or one piece of Swiss cheese, there's still holes in it. And there's still ways that the virus can get through or that there's still potential risk. But as you layer on all those different layers of Swiss cheese, you start to really plug those holes and can really do a good job mitigating risk. And so the more you can put in place, the better you are as far as that mitigation. And so we have some suggestions here that we listed, and again, have some resources as well at the bottom for you to look at. But it's really important screening for employees daily before they start work. And so whether that's just those quick symptom checks on the left-hand side of the slide here, but making sure that they're doing that screening prior to coming to work and really reinforcing that if you're ill, you should not come to work. It's really important that if you're ill, you stay home, you follow up with your PCP, and not continue to come through work. So those are the symptoms on the left-hand side that are really important to pay attention to. And then there's additional things that can be done at work. You can do temperature checks as employees come to work. There's different reminders that you can have throughout the day for employees to really make sure that they're paying attention to their symptoms if they develop them once they get to work. To continue that social distancing, the 6 feet between employees at workstations. And the masking part that Dr. Rue mentioned is incredibly critical as we go down this path. There's opportunities to educate, provide signage, avoid non-essential travel, and continue that work from home where possible. These are all, again, additional ways to help mitigate the risk. There's very specific guidance from the CDC and DOH for cleaning. And then really making sure that you manage and monitor exposures with contact tracing and making sure that you understand who potentially is at risk, monitor those exposures, and make sure that you have the appropriate follow-up. And as we've navigated through this space, there's a real opportunity to highlight the new digital solutions for healthcare services that now may be available that weren't previously. And so there's lots of solutions now, whether it's through primary care or specialty services, as well as health and wellness resources that are now available virtually that are important to promote to your employees as well, so they know that they can still receive care and should still continue to monitor whether it's a chronic condition or stay on that weight loss journey, whatever the case may be. And there's solutions available to continue to do that. That's a really important piece of this as well. Next slide, please. So again, the continued support has been really a focus for us, trying to understand how we can provide those enhanced digital health and wellness resources, as well as mental health resources and mindfulness resources, which are equally important during this time. I think another really important thing to remember is the importance of communication and making sure employees are up to date on communication that's happening across your organization. We have made enhanced efforts at the health plan to try and make sure our members and employers have had access to tools and resources, as well as enhanced communication opportunities to really stay connected, make sure that we're providing information as we become aware of it to help them, again, navigate through this. We've adjusted our services to support COVID efforts. We'll continue to do that. And again, as Dr. Rue mentioned, we have dedicated teams that are supporting the reopening efforts to try and help everyone do this successfully. Next slide, please. This is just an example, and so I think, maybe historically there was some concern that do digital wellness programs work, and is there value in continuing to do that? The face-to-face approach was always highly regarded in this space, and we've noticed that we've had great success with our online services and programs. We've transitioned almost all of our services completely to virtual for our diabetes prevention programs, our chronic condition management programs, and our freedom from smoking programs. And as you can see, based on the comments on the screen, that they're very well received by the participants going through the program, and they're still able to be successful. And in fact, they're finding ways to then, again, stay connected even outside of the classes with some of the peers that they're developing relationships with inside of those virtual classes. So it's become a really positive experience for many of our members who have taken advantage of those types of programs.
I think the whole industry, we all hear about how it's really accelerated the move towards telemedicine and virtual care. And that's one thing. We've done that as well. But the other is some of these disease management programs that have also been able to leverage remote influence over people to make sure that they stay healthy. Of course, diabetes, hypertension, these are the kinds of things that don't go away simply because there's a pandemic. And sometimes they don't necessarily need to see a physician, but they still need that coaching. They still need the care coordination, and our folks have been able to step in and not miss a beat. And I think that's been a neat way to continue to deliver those services and keep people healthy.
Absolutely. Next slide, please. This is an example, again, as Dr. Rue mentioned, this is our digital screening toolkit that's available for the general public. We would encourage you, again, to reference that. There's a lot of information on there, including frequently asked questions. So as employers reach out to us, we make a point to ensure that we get those questions posted on the site so that they're available for everyone to see, as many others may have similar questions. And this is really a tool that was developed by employers. It was done largely based on the feedback from the employers that we received, and we continue to enhance that and iterate the toolkit daily. So if you have suggestions for that toolkit, we certainly welcome them. And there's an area on the site where you can actually reach out. You can pose a question right on the site or provide some feedback as well. Next slide, please. And for our GHP employers, there's also a digital toolkit that has some additional member information, some additional member services. It highlights, again, the virtual programs that we mentioned, talks through some of the benefit impacts of COVID, that has some, again, more enhanced resources in a library that's available for those who have GHP insurance. That's another resource that's available as well. Next slide. And then just to note that we are also doing some other things for our community outside of kind of the normal programs that we have in place today. We have stood up a great resource called Neighborly. This is available for any person in the community to be able to log in and get information. We know that COVID has presented some hardships, not just in the medical sense for our community members, but they've also introduced needs like food and housing, transportation, and other services that maybe members of our community needed before, but COVID has certainly drawn to light and created that need for many others as well. And so this site actually has over 8,500 programs that are listed that allow you to go in, search by zip code. The majority of the programs are localized to that zip code. There are also some state and national resources in there, but really heavily focused on local resources. And this was slated to be up and running probably in the September-October timeframe for one area of our coverage area, but we actually have this now stood up for a broader network, and we're continuing to enhance this and build this out every day. But this is a great resource. And we also implemented a discharge transportation program where we provided over 200 rides. We have an emergency food distribution program. And then we did a couple other things that we did within the community to try and provide support, as Dr. Wu mentioned, for our nursing homes, our first responders, and continuing to partner with local food banks. And then we additionally provided some information and education for our Latino communities and employers through this process.
I think the Neighborly website has just been a home run. We continue to hear great feedback about it. It's basically having an army of social workers at your fingertips simply by accessing the website. Houses a lot of information and, more importantly, keeps it up to date, which I think sometimes is not the case for some of these support services throughout the community. But we know, and I think it's a sobering reminder that the virus has impacted so many people's lives beyond just the obvious ones. And bringing a repository of information where they could tap on resources and programs that could help them with a variety of needs, that's been instrumental to our effort. So I think we're shifting gears and turning it over to Kurt here.
Thanks, Jaywan, and thanks, Allison. I also wanted to thank Carl, Amanda, and the rest of the coalition team for the opportunity to speak on both COVID and the health plan. We very much value our partnership, and we look forward to continuing that partnership in the future. So going to the next page, we want to just, the next page, please, Lisa. Just to share some good news that we received from J.D. Power a little over a month ago. J.D. Power named us as the best commercial insurer in the state of Pennsylvania, something very exciting for us. And it's particularly exciting for us because we're hearing directly from our customers in terms of that evaluation. We have a lot of internal surveys and other activities that we do, but to hear that directly from our customers through a well-respected company like J.D. Power was very satisfying for us. It's one of the most prestigious awards that you can win in health insurance. And some of the things that they looked at really spanned across the entire health plan, and we just named a few of these, whether it's billing and payment, cost, coverage, benefits, and customer service, as well as communication and provider choice. Some of the things that were called out as part of the survey, one was communication, particularly during this COVID period as a standout for the health plan, but as well as improvement in our customer service, in particular the call center. We've seen some significant improvements, and we expect to continue those improvements, but it's exciting to see kind of the fruit of all the work that we put in as part of several different programs that we have. Next slide, please. A couple of things, and one of the core things that we do at the health plan is help groups and individuals financially. And there's been a lot of things that we've done on the health plan side, including eliminating cost sharing for COVID testing, as well as inpatient in-network services, and all that's through September 2020, and as well as doing the same for telemedicine services. Again, trying to ensure that we're providing the financial means to help people during this extremely difficult time with the COVID pandemic. One area that we're particularly proud of is how closely we worked with both employer groups and members to manage some of the financial challenges during this COVID period. We've done some basic things like we began accepting credit card payments, but I think more importantly than that, we're really proud of our willingness to extend some financial terms to employers who needed additional time to pay off the premiums. One thing that we are particularly proud of is we have not termed any group who has not either found coverage elsewhere or is not directly connected with us. We've not termed anyone. Every group that we've connected with and had discussions with, we've been able to retain with GHP, something we're proud of. Go to the next slide. Another piece, and we talked about it in the context of our work with JD Power, is communication. I think Jaywan and Allison mentioned it as well. It's important for us to connect with people on a regular basis on not only what's happening with COVID, but what's happening more broadly with the health plan. And so we've been distributing, putting out special weekly bulletins on the latest of COVID as well as other health plan activities to the broker community. Again, it hits into that theme that we've talked about in terms of communicating as frequently as possible regarding all the events related to the healthcare of our members and employer groups. Next slide, please, Lisa. As part of that outreach to providers, we've been particularly aggressive in reaching out to members, particularly those who are COVID positive. We have a special kit that includes several different additional resources for people that have tested positive for COVID. Within the health plan, it's roughly around 2,000 people that have tested positive. We've reached out aggressively to them to make sure that they have all they need, including a special kit with additional resources. We've also had constant communication with the provider network, including provider town halls, frequent updates, and active outreach to providers through phone and email. So a lot of our effort during this difficult time is that direct kind of communication outreach to our provider community and really all of our stakeholders, whether it's brokers, employers, as well as providers and members. Next slide, please. So I think like most employers in Pennsylvania, we're adjusting to the new normal. Almost the entire health plan at this point is working from home, but we've been able to maintain full continuity of business. I think few of us are going to forget the time when the governor came out and said that we all had to go home, and we certainly reacted to that. And I've been really proud with how the team has been able to change our business processes to respond to this new kind of effectively work from home policy that we've been able to implement. We're maintaining our service capacity across all functions. We've seen no degradation in our ability to manage and help our members through this difficult time. One of the things we're doing is just what we're doing right here, which is having ongoing webinars for groups, brokers, as well as providers, as well as customers and members as well. So it's trying to take a more proactive outreach through mediums like this that we're using today.
Next slide.
Yeah, and I'll turn it over to Jaywan to provide some additional background. But when we think about some of the key differentiating features of GHP, and we've really seen it today with the work that Allison's doing with the employer community, it's providing a greater continuity, greater connection between the health plan as well as the health system. And you're seeing that with our willingness to go out and meet with employer groups to talk about the appropriate way to deal with COVID. Another thing is just our local nature. We're very close to central Pennsylvania. This is where our headquarters are out of Danville. We're very much connected to the center and certainly the eastern part of the state, the northeastern part of the state. And I think it's one of those things that's really differentiates us relative to other health plans. Our orientation is, of course, to provide financial protection, but it's also to think about clinical solutions for our members and employer groups. Joe, anything you want to add to?
Yeah, no, I think you said it well, Kurt. When we bring together the care and the coverage, meaning the clinical enterprise, the clinical aspect, but also bringing together GHP, i.e. the health plan aspect, I think it allows us to get the right focus on things like prevention, take a holistic view around a person to make sure that we're doing what we can to keep them healthy, out of the emergency rooms, out of the hospitals. And that's been especially true during this time of the pandemic. I think it's been validation of what we've always suspected, which is when you have that insurance and the care delivery married together, you can focus on communities and prevention and populations and the whole individual. And that's exactly been true. And it's been important, obviously, especially so during this pandemic. So we're eager to continue to engage with you all and with others in the community. And I think we'll turn it over now to questions. So I don't know if I saw a few things pop up here in the chat section. I don't know, Amanda, if you saw any questions or if you want to channel any of those our way.
We have a couple we received ahead of time, so I'll be starting with them. Thank you all for your presentation today. Very informative and a lot of data and detail in there for all of us to be thinking about moving forward. I will remind everyone to please submit your questions using the Q&A tool through the Zoom webinar tool. Just to get started, I know vaccines are always a huge question on all of these webinars we do, so it seems like a good point to start with there. Obviously, today's presentation was focused on getting back to business, but we also want to be able to continue business. Could you provide any thoughts you have as a system of what the timeline for not only vaccine development, but what are realistic expectations around when people might start to see them and have access to them and how that rollout might occur?
Yeah, so maybe I'll take that one. And we get asked this question a lot. I think the short answer is it's unclear and no one really knows exactly when a vaccine will emerge. That being said, though, there's a lot that we should feel pretty optimistic about. So 3 different vaccine efforts entering phase 3, as I mentioned earlier. That's very reassuring because phase 3 means that the development process is fairly far along. But then, of course, you got to work your way through that phase 3, and still you have to contend with how you manufacture enough doses to get it out to the population. So some of the estimates that I've been reading, that I'm sure you all have been reading as well, whether it's very early in the new year or into the months soon thereafter, I think that's, if I had a best guess, I'd kind of pin it around that ballpark. But at the same time, to get it broadly available throughout the population, it could take a little longer than that. And then, of course, the biggest question mark I would continue to remind folks of is, if we find a vaccine that elicits the right antibody response or immune response, which I believe we will, what is still unclear is how long that immunity lasts. And so it may not be the kind of vaccine where you get it once in your life and you have immunity forever. And it's unclear if it's even one of those vaccines that you get it once per year and you're good for that year. I think that's still a lot of what still remains to be seen in the trials, is how long does that immunity last? All of this is underscoring the importance of what we've been emphasizing throughout this and other efforts. We got to learn how to manage with the virus, because it may be that we need to keep practicing that because we may need to keep doing it for a while. And that is the masking, the distancing, the hand hygiene, all of the things that you heard us talking about today. It's especially important because it's unclear what the timing of the vaccine will be and what the efficiency or effectiveness of that vaccine will be. And so these fallback tools or capabilities, whether it's masking, distancing, or hand hygiene, that's going to help us regardless of those things.
Okay, thank you so much. And because it is such a hot topic and it gets into kind of a larger issue we sometimes see on the employer side, under vaccination in general continues to be a problem. If you've ever been to an employer during flu season, you know how difficult it can be to get people to get their vaccinations. And Allison, I know on your side, you've probably helped employers with these in the past. Do you have any best practices or tips or just thoughts that employers should keep in mind? Certainly as people need to be getting their flu shots this year, as well as getting the COVID vaccination when it becomes available.
Yeah, so flu shot vaccinations are incredibly critical, as it was mentioned earlier. Certainly we're paying close attention to what we can vaccinate against this fall, and flu particularly is one of those that we can. I think it's really important, as employers may have some work from home individuals, to still really stress with those work from home employees that it's still very important to get those vaccines. We want to make sure that just because they're not coming into the workplace doesn't mean that they shouldn't still get those. So that's really important. And then what we've done historically to try and help with some of the logistics is we'll actually provide flu vaccinations on site for employers if they have GHP insurance. So I would encourage employers to look for opportunities to have vaccinations actually on site for employees, so they don't have to schedule some additional time off of work. That tends to really help with the compliance rate overall. So that might be another opportunity. And then again, just really educating, sending out messaging wherever you can incorporate it in your communications, whether it's in print or encouraging the managers to make sure that they're stressing the importance of getting a flu shot. Those would be the areas that I would focus on.
Cart, is there anything additional that they can think about from the health plan design or anything like that as it relates to vaccinations this year and every year?
I think it's something we very much encourage, obviously, especially the flu vaccine. We can obviously work on plan design features and things like that. I think the one thing I'd add to what Allison said is I'm not a clinician, but as I understand from a clinical perspective, it's extremely important to get the flu vaccine. And you want to encourage any plan design where it has such effectiveness to keep the cost sharing as low as possible. And this gets back into why we're providing, certain services, treatment, as well as telemedicine with no cost sharing. So given that effectiveness, I'd certainly encourage any plan design features that are so effective to be done with no cost sharing.
I think the challenge with flu vaccines and sometimes vaccines in general is people say, well, I got the vaccine, but I got the flu anyway. And that's right. It's not 100%. But if I were to offer you something that cut your risk in half and cut the risk of something bad in half, and it probably does a better job than even that, you would be a fool not to take it. And it's sort of similar to wearing a seatbelt if you're getting behind a car or getting behind the wheel in a car. That's not 100%. Some people die of terrible car accidents even though they wear their seatbelt, but we know that in the aggregate, seatbelts drastically reduce the risk of really bad things happening. It's the same thing with the flu, and getting that education out there is critically important. I think the other is what Allison touched on, making it as easy as possible for people to get the flu shot. We know that helps more of them do that.
Hey, thank you so much. Next question. If there's anything we hear being questioned more than about vaccines, it's about schools. It seems when you're watching the news that a lot of decisions around schools seem to be driven by politicians or parents and not necessarily medical experts like yourselves at the health system. If you could do anything related to schools this fall opening back up or going online, what ideas would you encourage people to keep in mind or to try?
So I think from that perspective, you're right. I think the guidance early on, if we would have looked even 2 months ago, was very limited for schools. And that's why, especially in our coverage areas, schools partnered with us early on to say, how can we do this in the best way to mitigate risk for our students, knowing that it's a very uncertain time for schools, whether it's K through 12 or colleges and universities. And then additionally, there's been guidance put out by the Department of Health as recently as 2 weeks ago that offered some additional support and recommendations. I think it goes back to my comment earlier that every school district has its own set of challenges and advantages throughout this process. And I think the guiding principles need to be that if a school is going to reopen, how do they put the most layers in place to try and mitigate the risk for those students who are coming back, as well as the educators and the community that those schools are in. And so what we've been trying to do is offer some guiding principles, and we can send out, I believe, Lisa, there's probably an opportunity to send out links after this, but we can send out a link to this group with some of what those guiding principles are that we've developed for school districts to try and help them mitigate the risk as much as possible. There's a lot of challenges in that. There's a lot of personal accountability for parents and students. And there's a lot of pressure on schools to be able to do this effectively. But that's why we've taken the approach where we've really tried to get individualized, help them look through their plans, and really help them navigate through it.
Okay, thank you. Earlier in the presentation, there was really a push sick people to stay home if they're sick. Certainly it's a problem now, but that's something that's a problem all the time. I'm always thankful that I am at a job where I can stay home and have access to sick time. But I've always thought of the irony that someone in the service industry, you know, I don't want someone with a stomach bug cooking my food. But I also know that those are the people who are most likely to not have sick time, or who, you know, are at the most financially disadvantaged if they need to take that time. Have you done anything at your own network to encourage employees to stay home when sick? And have you helped employers in the community think about their plans and how they address this moving forward?
Yeah, so we would encourage employers to look at their policies, obviously, so that it's not detrimental for employees to stay home if they are sick. And we did put some policies in place here if our employees needed to be off because they were quarantined, or if for some reason they were sick, they would not be penalized for that process. And so I think it is really important to look at what your policies and processes are for sick time. And we actually, even with the schools, recommended that they remove perfect attendance awards for children. And, you know, they really look at their policies as well for their faculty and staff. So making sure that those policies do support, I think it is more challenging, frankly, in the service industry. I know that that's a much more challenging space. But if there's any way to still get creative, you definitely want to avoid sick people coming in to work, and you want to make sure that they're getting tested and getting the appropriate care. So working with those individuals to make sure they know what resources they have available. If they don't have insurance, making sure that they have the information for what insurance options may be available for them, so that they feel comfortable even getting the services taken care of. And then just reviewing your own internal policies to make sure that that aligns.
Thank you. We did receive one question coming in, and they are specifically asking about the pneumonia vaccine and diabetic patients. But I actually want to even maybe ask for a little more of a global perspective on this. When things were first started related to the pandemic, obviously we knew that certain comorbidities were having worse outcomes, definitely some racial disparities going on. It seems like that's still going on, but maybe not so much in the news. Wonder if maybe there could be an update on, do we know now which patients, which comorbidities put people most at risk? And do we have any things that we can encourage higher risk individuals to be doing beyond just the staying home, social distancing, and wearing a mask?
So maybe I can start, and Allison, please weigh in. But you'll recall very early on in the pandemic, the belief was, as you allude to, that this was predominantly afflicting folks who are older or have multiple comorbidities. I think that myth has been thoroughly debunked. What we've seen and what we continue to see is while they do carry a higher risk, we are seeing plenty of hospitalizations and deaths in folks who are younger with no comorbidities. It's sort of how your body's immune system responds to the virus. And so just earlier this week, or last week, I should say, I heard from some colleagues we have out in Pittsburgh on the western side of the state, and they are now seeing that over 40% of those hospitalized with COVID are younger than 45 years of age. So that should tell you a lot, that young people can be afflicted with this as well, and they could have very serious effects from the virus. And so I think there's a little bit of it. The virus doesn't see age or gender or socioeconomics. It's going to affect, and it very well could affect, a whole host of people. Now, that being said, there is a higher risk if you have multiple comorbidities, and there is a higher risk if you are older, but it doesn't protect you necessarily if you don't have those things. It could really affect everybody, which is why we worry about spread so much. We would worry about it even if it afflicted the older or the folks with more chronic comorbidities. But even as it's hitting anybody out there, I think it's a reminder that it could be anybody, and we all have to do our part in order to keep the risk to a minimum.
Yeah, and I think just to add to that, it speaks to the comments earlier, I think, Dr. you mentioned about making sure that even those with a chronic condition are having their appointments, they're still seeking their specialty care, they're managing those chronic conditions. Because if they're managed versus unmanaged, where they're at much higher risk anyway from illness and other issues, so optimizing some of those resources that are available, making sure that just because this pandemic is here, that you don't forget about managing your diabetes or your hypertension or some of these other things. Again, focusing on prevention, to still be trying to quit using tobacco during this time. There's been some national advertising around the importance, now more than ever, of stopping tobacco use and making sure that those resources are available for our communities and for our employers, I think is really critical. So those types of programs, I think, are also really important.
Okay. Well, I'm going to take one last chance to remind anyone with questions to put them through. And since I'm not seeing any more, I think I would just maybe ask for one last piece. And if you all want to go around, or if one person wants to make your closing remarks. But up until this point, I think there's kind of been opposing viewpoints being presented, that it's either address the pandemic or address the economy, instead of the thought that we can do both if we do it safely. Do you have any kind of closing thoughts or reminders that you'd like to send out to our audience as we move forward, and instead of just focusing on opening the economy back up, that we focus on what we can do to keep it open?
Yeah, so maybe I'll start.
Yeah.
Please feel free to weigh in, but we believe you can do both. And we've been saying that for quite some time. But, and it's a big but here, it really does require people to be paying attention to the precautionary efforts. And that is the masking, the distancing, the staggering, the hand hygiene, and so forth. But if you're doing those things responsibly, we absolutely think that you could have the recovery of the economy, reopening of businesses, but also keeping the virus at bay. And we've seen that. We've seen at a lot of our early efforts here in the Commonwealth, it really brought the level of the virus down to a nice trend. But at the same time, we can't let up on those efforts. And I think that's something we got to keep focusing on. Allison?
No, I totally agree. I think it can be done. I think that's why we've spent so much time really trying to assist our community partners on how they can mitigate the risk and the things that they can do that are realistic for their individual company or for the schools, to try and help them navigate through so that they can successfully reopen with these additional safeguards in place to try and help mitigate the risk. So we can do both. And so I totally agree with that.
Yeah, the only thing I'd add is I think you have to do everything as kind of all of the above from a precautionary perspective. We've outlined a lot of things. The other thing I'd add is flu vaccines. You just need to do everything. And it's because from a precautionary perspective, it's extremely important. If you don't control it, it can easily get out of hand fairly quickly. And I always like to quote what Jay Wan says, which is, we're all in this together. And it's important to think that way as you think about not only taking care of yourself, but doing these precautions. It's important not only for the community, but in particular for health workers, and making sure that everybody is healthy as possible. And I think, and I agree, it's not necessarily a trade-off between the two, but your own personal actions must be in consideration of your community as well as health workers.
Okay, well, I see we are at 1 o'clock now. We do not have any additional questions coming in. Just like to take 1 minute to thank Dr. Rue, Allison, and Kurt for being with us today, for your time and your very knowledgeable presentations and answers. I'd like to thank both of our teams at the Coalition and at Geisinger for helping pull together today's event. It's a lot of people not on camera today that really help pull these things off. And to all of our associate members and employer members for taking the time to join us today. We will be posting the recording, the slides, and additional information on the website and follow up to this event. They should be up in the next couple days, and they can be found at the LVBCH website under the past events page. Just hoping everyone stays healthy and well out there, and thank you so much. Have a wonderful day.
Thank you.
Thanks, Amanda.
Thank you.